Hello, everyone. Once again, it's your girl Lakeitha with New Mount Calvary with Wellness Wednesday. And once again, we are joined by Dr. Charmille Hare with Piedmont Family Physicians in Locust Grove.
Yes.
And today we will be discussing diabetes.
Oh, yes.
That is a topic that really needs to be discussed,
Absolutely.
especially in our African American community.
Yes.
So, Dr. Hare, let's just jump right into this thing.
Yes, ma'am.
So, can you tell me what exactly is diabetes and actually tell us the difference between type 1 and type 2 diabetes?
Okay, well, I'm just going to joke around and say, sugar diabetes. I'm sure
Yes.
you've heard that term. I hear that a lot. We're in the South. Oh, that's sugar diabetes. Well, there are two types of diabetes. There's type 1 and type 2.
Mm-hmm.
So let's kind of start with what diabetes is. Diabetes is elevation of blood sugar in your blood. So we all have elevations of blood sugar in our blood. Anytime you eat something, typically that has any type of carbohydrate in it, you're going to see an elevation of that sugar in our blood. Then our pancreas secretes insulin. That insulin has the sugar absorbed into our body so it can be used to do different things that our body requires. The energy it requires to work the muscles, to work the heart, to work whatever it is it needs. And anything excess usually will get stored as fat or in the liver as glycogen. So when a patient has diabetes, there is a dysfunction in the way our body stores the sugar. And since it will not store properly, it ends up just floating in the bloodstream, which then leads to damage to all kinds of organs. And when you take sugar and you melt it down and get into a certain temperature, it can get very sticky and tacky. So imagine that blood is sitting in your body that's right at 98 point something degrees and is moving through blood vessels, and these blood vessels move all over your body, through your kidneys, through your heart, through your brain, through all kinds of organs. And so that causes damage over time, okay? So that's what diabetes is. It's a dysfunction of sugar. Our body will not store the sugar, will not put the sugar where it needs to go, so it ends up floating in the blood, okay? Type 1 is unfortunately like a genetic form of diabetes most of the time. It's usually younger people. And then type 2 diabetes typically is in older patients or patients who are significantly overweight or have other health factors that lead to them to becoming diabetic. Now, there is a strange type. There are all kinds of types of diabetes, but we know of 1 and 2 are the main ones we know about. There's what we call MODY, mature onset of diabetes in youth, where you can have a 12 or 13-year-old have diabetes but not have to be on insulin, can actually be on pills. And then you have adults who develop diabetes, but it's not type 2, it's similar to type 1, and they have to be on insulin, nothing else seems to work. So there's all kind of variances within diabetes, but the ones we know more typically are type 1 and type 2. Type 1 and type 2 are treated very differently.
Okay. All right. And we will talk about the treatment in just a second, actually.
Sure.
Let's see. Can you tell me how diabetes is generally diagnosed?
So generally, we diagnose diabetes based on blood sugar. And there are 2 blood sugars that we look at. So if you come into a doctor's office and you've been fasting anywhere from 4 to 8 hours, we expect a fasting blood sugar greater than 126. So if your sugar is greater than 126 fasting, that most likely means that you are diabetic. That means there's too much excess sugar hanging around. Somebody who doesn't have diabetes, like I don't have diabetes, if I check a fasting sugar, my fasting sugar may be 90. That's considered normal. Anything above 126 fasting is known as diabetes, okay? Now, if let's say you didn't have time to fast and you show up in the doctor's office and say, oh, I ate earlier, our body still is able to clear food pretty quickly and clear sugar pretty quickly. So if you have a random, what we call random blood sugar, greater than 200, that still most likely means that you're diabetic. So if I'm just randomly checking your sugar today, Lakeitha, and I don't know when you last ate, but it's been within the last few hours or even within an hour, your sugar should still be less than 200. And if it's still elevated, if it's above 200, most likely you are diabetic. So that's how we diagnose it. Now, once we've seen this elevated blood sugar, typically what happens is you come in the office for routine labs. We know you have a family history, but we're not sure that you have it, okay? And you may not have any symptoms at this point. But we do this random sugar fasting, and your sugar is 128. then what we'll do is usually have you come in and do a secondary test. That secondary test is known as hemoglobin A1C. And that test is going to tell us what your sugar has been running for the past 90 days.
Okay.
So we get that sugar is only one moment in time. We want to see what the trend has been. And the A1C is correlated to the average blood sugar that your sugar's been running on a daily basis. It averages that out for us. And so that number tells us whether your average has been normal, elevated, or really high. Because when you prick your finger in one moment, when patients are at home and they say, well, I've been checking, my sugar has been good, you're only checking it one moment in time. We don't know what the trend is. And so the A1C helps us to see the trend, see what your sugar's been running overall. Before A1C, Lakeitha, and before we started using A1C in the office, I remember when I was in residency, I think it was in medical school or residency, I remember before A1C became a real thing, patients who were diabetic would eat horrible for 2-3 months. And when it was time for that 3-month appointment, they were a saint. They didn't eat nothing wrong. They had no sugar. They didn't drink any sweet tea. They didn't have any donuts. They were phenomenal.
Yeah.
And then we would check their sugar that morning, and it would be 110 or 115. We're like, oh, you're great. But these are the same patients who are having heart attacks, strokes, losing vision, having kidney damage. And so it never made sense. So this A1C has been the best test ever. Can I tell you, Lakeitha? Because you can't cheat this test.
Yes.
It's going to tell on you. And a lot of times when patients come in like, oh, Lord, Dr. Hare, what you going to say to me today?
Exactly.
I said, this test told on you. What you been doing? And now I can ask more important questions. So rather than you pretend that your sugar's controlled, I can know whether it's controlled, and I can be prepared for possible complications because it's uncontrolled.
Right. So what is the number to say once you do the hemoglobin A1C, what is that number that says, yes, you are diabetic?
Okay. So A1C greater than 6.5 means that you are diabetic. And I've had patients argue. I had a patient leave another practice and come to my practice and say, this doctor is saying I'm diabetic, but this A1C, if your A1C is greater than 6.5, you are diabetic.
Okay.
Period. Okay. How we control that diabetes is based on how long you can stay 6.5 to 7.
Okay.
So that should be more the argument. Whether you are or not, the numbers don't lie. However, whether you need to be on medication or not at that point is based on whether you can stay below 7. Okay. The goal for A1C for anybody who's been diagnosed with diabetes is less than 7. Okay. So if you can change your lifestyle, eat really clean, and stay below 7, I won't pester you to take medication. But if you're not going to do the necessary work to control your diabetes with your lifestyle and your diet, then we definitely have to do medication. Okay. So 6.5 is the number. Now, there are other numbers that are important for us to know, Lakeitha. If your A1C is greater than 5.8, some doctors will even say 5.7, that means you're insulin resistant. That means you are pre-diabetic.
And that's what I was about to ask you to talk about. What's your view on pre-diabetes?
It's a real condition. Okay. You know, the thing about our body is it will try to help us until it just can't do it anymore. And so typically what happens is for type 2 especially, type 1 doesn't really fit this because unfortunately this is just a problem with your pancreas not creating insulin properly. So there's really nothing you can do to prevent that per se. But for type 2 diabetics, let's say you love having that sweet tea every day or that Coca-Cola. There's somebody I won't mention who used to love.
Delivered.
Hallelujah.
Thank you, Jesus. Yes.
Hallelujah. But there was a time where I had a friend who loved to drink Coca-Cola every single day.
Yes, Jesus.
Okay,
yes, Jesus.
So let's say we have Coca-Cola every single day. What happens initially is your body tries to compensate for that problem. So first you'll have this sugar rush in your body. Your body will try to figure out what to do with the sugar. Okay, what am I going to do with the sugar? Let me secrete insulin and get your body to absorb all the sugar, and we'll put it in different places. We'll put it in some fat, or we'll put it in your liver, or we'll put it in some of the muscles. We'll use it other places. Well, there's a point where you stop being insulin sensitive, and that's what insulin resistance means. That's pre-diabetes equals insulin resistance. At some point, your body does not respond to the insulin. So your pancreas sends out the insulin. Your body's like, you send this stuff out all day long. Why are you sending this stuff over and over again? So it becomes less sensitive to the insulin secretions. So over time, our body starts not really paying attention to the insulin. And so then what ends up happening is that sugar doesn't get absorbed because it's too much of it over and over and over again every day. So at some point, our body just does not accept that sugar, does not absorb it, and it starts to float around. And that number gets higher and higher. And there are times, some patients who are pre-diabetic will have, I've had patients describe this to me where it feels like if they don't eat, they're about to die. You know, like they have a crash. And what happens is if you've been fluxing your body with so much sugar, sometimes your body will secrete so much insulin that your sugar will drop. Sometimes that can be a precursor to diabetes. So if you notice you get real ill and real moody before you need to eat, that can be a sign that something's not right with your sugar.
Oh, wow.
So our body warns us about these things all the time. We just ignore it. And so at some point, your body's trying to get rid of sugar. That's why you have to pee 4 or 5 times at night. You're always thirsty. Your body's begging you, please drink some water. Try to filter some of the sugar out. And over time, we go from insulin resistance to finally your body gives up. Well, I guess this is just how it's going to be. And then now the blood's just floating in, the sugar's just floating in your blood. Yeah.
That's good. That's good, because you do hear a lot of people say, well, my doctor says I'm pre-diabetic, so I don't have to do anything right now. They're not putting me on any medicines yet. They just want to watch and see what happens to see if I'm able to maintain or if I actually turn into a full-blown diabetic.
Yeah, and we don't want to, we're waiting as far as medication, but you don't need to wait. You need to do something. You know, it can be diet, lifestyle. Something needs to happen in between. I always tell patients, when we find out you're insulin resistant, I said, you know, first thank God for it, because this now gives you an opportunity to do something and possibly reverse the risk of you becoming diabetic. Once we're there, we can still reverse it. It's just harder. The more resistant your body is to insulin, the harder it is for you to lose that weight, harder it is for you to get that sugar under control. So when you're in insulin resistance, that's like a golden opportunity to work with your body and decrease insulin resistance and make your body more insulin sensitive over time.
Got it. Very good. Very good information.
Yeah.
Let's talk about some risk factors for diabetes.
Yes. So, you know, diabetes, the same thing we talk about with blood pressure. There's patients who have a genetic propensity. So you can be a pretty good eater and not eat too much junk, but, you know, your family history, mom has diabetes, dad has diabetes, my sisters have diabetes. So it's very possible that could be a genetic propensity. In my experience with type 2 diabetes, majority of the time it's not just I see less genetic diabetes as more habitual diabetes, meaning that these are familial habits. Everybody cooks the mac and cheese this way. Everybody makes their apple pie this way. Everybody makes their sweet tea with half a pound of sugar. And so what we're calling genetic, it's not genetic, it's bad habits that have been passed down from generation to generation. And so majority of the time, in my experience, with diabetes, less genetic, more habitual. More habits that have been passed down from family member to family member. And unfortunately, in our community, the food is phenomenal, but it's not always very good for us, or it's not made in a way that that is healthy for us. There's too much sugar, and too much carb, and not enough protein and vegetable to match it. And so when you have that much carb over time, it's going to eventually, your body's going to get overwhelmed by it. So that's my experience, is more habitual bad habits. Lots of sugar, lots of carbs, being significantly overweight, because that means your body's already been trying to store all this extra energy, and it gets stored in your body as fat. And so that can be a risk factor as well. Obesity is a factor. Not being active is a factor. In fact, one of the ways that you treat insulin resistance is to increase muscle mass. So the more muscle your body has, the more it has to burn the calories that you intake, including the sugar. So if you increase your muscle mass, especially in your lower half of your body, that decreases insulin resistance. And so if you're, you know, a couch potato who eats a lot of sugar, is very inactive, and you're overweight, you're going to have a higher propensity towards having type 2 diabetes.
Okay. And is that, because, you know, I know some patients you see have that big belly.
Yes.
Is that typically associated with diabetes?
Yes, very typically is. That goes along with the insulin resistance and fat storage. Your body's trying to store that fat. And so it has to find places to go. And when it's trying to put it here and put it up in your chest and put it in your arms, it has to go somewhere else. And unfortunately, one of the places that it goes is right there in the abdomen as well.
Okay,
Yeah.
very good. Very good. So let's talk about treatment for diabetes.
Yes. Well, we touched on some of it already, which is one of the first things we want to do is try to make those lifestyle changes.
Yes.
A lot of times I'll tell patients, if you drink a sugary drink every day, if you were to just cut that out, you'd be amazed how much weight you'll lose and how much sugar improves just by cutting out sugary drinks.
So you telling me to stop my Starbucks?
Yeah, all that sugary soda,
really?
juice, all of it. I love you, girl, but I'm gonna tell you the truth. You know that about me. I'm not gonna lie to you. I always tell people, if you're drinking something and the calories are not helping you in any way, it's a waste of calories. Now, I love tea. I'll put a little bit of honey in my tea, but majority of the time I'll just drink the tea. Because that extra sugar, if I don't need it, I'm not going to ingest it. But what's in the tea I want? I want the antioxidants. I want the ashwagandha, or whatever I'm drinking in that tea.
That's a big word, Charmille.
It's a herb. It's a herb that helps with relaxation and keeping you calm and mental health and stress. But anyway, ashwagandha. So anyway, that's what it's called, ashwagandha. So if I want to get the benefits of the tea without getting the negatives out of the tea, I just can't have it with sugar. So when patients say, well, I love tea, and tea is good for you, but all the sugar you put in that tea is why it's not good for you. So I'm not opposed to tea. I would just rather you drink unsweetened tea. Okay. So that's the whole point. Soda doesn't have any nutritional value.
Right.
That's excess calories. One can of soda, depending on whether it's diet or not diet, has anywhere from 150 to 250 calories in one either can or bottle. I mean, that's a whole meal.
Yeah.
You can eat a whole meal for 250 calories versus eating the calories, drinking those calories. So they're just empty calories that have no nutritional value to you. They're not adding any vitamins to you. They're not adding anything to your body other than just being stored as fat. So, or excess just hanging around in your bloodstream. So the diet is very important. Exercise, increasing muscle mass is another thing that's really important. Weight reduction. Do you know that some patients who have either prediabetes or diabetes, when they have gastric sleeve surgery, for example, can immediately reverse their diabetes.
Wow.
So we know that weight loss definitely affects blood sugar and how our body processes blood sugar. So it's really important to try to lose some weight, as much weight as you can, to get to a normal body mass index. Anything under 30, even if you're overweight, your sugar is going to more likely be controlled than being obese. And so that's one of the other factors. Now, when we've done all of that and we're still not seeing improvement in your blood sugar, at that point it's time to do medications. The most common medication is usually metformin. That is first line drug for every patient who is diabetic. And I'm going to answer this question for you because I hear it. I hear the question because everybody and their mama has something to say about metformin. Metformin is an old drug. It's been around for a long time. And metformin does what, if you were to do in your own body, that's what metformin does. It sensitizes your body to insulin. When you exercise, you sensitize your body to insulin. And so we're making our body sensitive to insulin again, so now that sugar can be used in your body rather than just floating in the bloodstream. That's the whole point of metformin, is to sensitize your body. Oh, this is insulin, and starts absorbing the sugar again. So that's why it's first line. Now, yes, I've had patients say metformin causes kidney damage. It does not cause kidney damage.
Okay, very good.
Does not cause kidney damage, okay? What metformin does, if your kidneys are already damaged from your uncontrolled diabetes, if your creatinine gets above a certain number, taking metformin can cause a condition known as lactic acidosis. But metformin itself does not damage your kidneys.
Okay.
In fact, it preserves your kidney function if you use it like you're supposed to. The only other thing patients will have with metformin is they'll have GI upset. And in my experience, now I don't know if this is based on medical data. I'm just going to tell you from my experience. My experience is the patients who have really bad GI effects from metformin are eating nonsense. Now, if you're eating very clean and you're eating well and you're staying away from excess sugars and excess fat, the metformin will irritate you a little bit, but not enough to cause significant problems. But if you're still eating those cookies and that candy and those donuts, that metformin will wreck your belly.
And when she say GI upset, guys, typically that's diarrhea.
Yes, diarrhea, running off, gas, bloating, just nausea for some people even. And so that is usually based on that patient's diet. But there are ways around that because metformin comes in short-acting metformin and long-acting. And sometimes we'll switch patients to the long-acting and all the GI effects minimize, if not all the way, go away. So don't let that be an excuse not to take metformin.
Exactly.
Yes.
Now, with metformin, let me ask this real quick before you, I guess, jump into whatever other treatment options. But is it true that metformin also, in the meantime, with helping with the diabetes, also helps with the weight loss, which in turn can help with the diabetes?
Yes. So
what is your take on that?
The data is kind of in between. We've not seen a lot of, like for patients who have insulin resistance or a condition known as PCOS who use metformin for weight loss, they don't see significant weight loss.
Okay.
So I don't necessarily prescribe it and say, well, by the way, you're going to lose 10, 15 pounds.
Very good.
Some patients don't see significant weight loss when they do it. Now, if you do metformin with lifestyle and dietary changes, because your body's now sensitive to insulin, we will see some more weight loss.
Okay.
But can you say that's from the metformin or is because you're doing what you're supposed to do? It's hard to say. So I don't know if we can really say that to be true. The evidence shows some for and some against that. No, metformin doesn't necessarily cause significant weight loss.
Okay. Very good.
Yeah.
Okay, so if the metformin doesn't work,
Yes.
what's the next?
So there are about 4 or 5 categories. If you're a diabetic in this day and age, you are living in the golden age of diabetes, I would say. So people who do not take advantage of the diabetic medications, they're losing out. Because there are new drugs out that have been out as long as I've been practicing. So they were new to me, you know. We know about metformin, and then we know about sulfonylurea. Sulfonylureas are things like glipizide, glyburide, those kind of medications that help bring your sugar down. But there are new drugs on the market. SGLT2s, which is a category of drugs which help your body get rid of sugar through your kidneys. Then you've got DPP4s, things like Januvia, Tradjenta. You've got new drugs like Farxiga and Invokana, Jardiance. You've seen the commercials for all these drugs. But these new drugs not only help you to control your blood sugar, but a lot of times help patients lose weight. Sometimes prevent heart failure. Because a lot of diabetics over time start having damage to their heart even before they know they're having damage. So these drugs have multiple benefits for these patients. And now there are even injectables that you can inject once a day, once a week that are not insulin that can help you control your sugar, and a lot of them cause you to lose weight. To get to a healthy weight. And sometimes that injectable is the only medicine you need if you do the lifestyle with the injectable medications. Some of them are actually been used or proposed to be used for weight loss because people lose so much weight on it. And so there's so many new drugs out there for diabetics. So patients get diagnosed with diabetes, they panic. Oh, if this medicine doesn't work, I'm gonna end up on insulin. And I will tell you is with everything we know about diabetes now, there's a rare patient that if they do what they're supposed to do and take the meds like they're supposed to, that we really have to put on insulin right away. Those patients that go on insulin right away are usually patients whose A1Cs are very high on diagnosis and we need to drop it down quickly, or patients who have a type of diabetes that acts more like type 1 even though they're older. So those are the patients who end up on insulin and just stuck on insulin. The majority of the patients who have type 2, with lifestyle, with diet, and with the medications, if they're compliant and do what they're supposed to do, they don't have to go on insulin. One of the patients I saw one time, Lakeitha, was trying to find out how quickly they end up on insulin. It was a husband and wife. And the wife had been diabetic for 30, 40 years and just got on insulin. The husband hadn't even been diabetic 5, 6 years and was already taking insulin. The difference between the two was based on the wife was very compliant with her diet. She was very active. She was compliant with her medicine. So for well over 30 years, she had controlled her diabetes just on medication. Her husband, on the other hand, never followed the diet. He's like, I don't want to eat that. That don't taste good.
Of course.
Maybe why you make me this or make me that? And unfortunately, his diet and his lack of activity is why he became a diabetic on insulin in a shorter amount of time than she did. So you can prevent that. Diabetes is a progressive disease. It progresses over time. The progression, the speed of progression is based on how compliant you are, how well you take care of yourself, how well you eat, how well you exercise. It will progress eventually. But like I said, the patient who is now on insulin still has absolutely no complications, no kidney damage, no heart damage, no eye damage, no neuropathy. And she's been a diabetic for 40 plus years. So I'm telling you that the patients, and she's a rare bird. I tell her all the time. I tell people about you don't even know. I don't mention your name, but I mention her all the time. She is so compliant. Her compliance is why she's done so well for so long as a diabetic. It really, you have the power to control your diabetes, but it's up to you.
Very good. So you touched on this basically when we talked about it is possible, or did you? Is it possible to come off of your medications when you've been diagnosed with diabetes?
Yes. Similar to what I said with high blood pressure. Depends on whether this is a genetic form of diabetes, if it's a type 1, or we'll call it type 1B, which is you get later onset, but it acts like type 1. So you have to be on insulin because your pancreas just stopped making insulin. Those patients, unfortunately, have to stay on insulin, and they have to stay on medication for life. But for those who do not have that form of diabetes, can you reverse it? Yes. And the earlier you get on top of it, the more likely that is to happen. The longer you wait, the harder it is to reverse it, in my experience. So if I have a patient who is done very well, gets diagnosed and really starts making those lifestyle changes, I've seen patients reverse. I had a male patient who reverses A1C from like 9.6 to 5.2 in a year. He was no diabetic. I had to take him off all the medicine. I said, he said, yeah, my sugar's dropping. I said, you need to come off of it altogether. But he got very drastic. He got very serious, and he was dedicated to the process and came off of, I think, about 4 or 5 meds to nothing.
That's awesome.
And we recheck him every 6 months. He comes in every 6 months. He checks his sugar. His A1C is still perfect. He picked a lifestyle that was going to work for him, and he maintained it. So he has come completely off of medicine. He's a rare bird too, because the problem is people aren't willing to do the necessary steps to maintain what it's going to take to do it. He's willing to do that. He has kids. He's motivated. He wants to be a good example. And so I think that's why he's going to maintain it long term. I really believe he will not be diabetic again. But for a lot of patients, they'll drop it and then they'll get back into bad habits and the sugar start coming back up again. So yes, it is reversible, but you're going to have to make a drastic lifestyle change. You're going to have to make a choice and say, is it worth enjoying the sugar every day for my health? And for some patients, it's not an option. They're like, I do not want to live like this. And they will completely cut out sugar and they make that change. For some people, sugar draws too much. Then I say, well, follow the 80-20 rule. 80% of the time, don't eat it. The 20% you enjoy it. If you want that slice of cake and eat it, don't feel guilty. But if you've done well all week or even all month and you eat that birthday cake, you're not going to feel guilty about it. Yeah.
Okay. Very good.
Yeah.
The last thing,
yes,
which is once again the more serious side of all of this, complications related to diabetes.
Diabetes is a very complicated, the complications are, significant. And I think everybody can think of a person who's diabetic in their family and the complications they've had from diabetes. And that's why typically when patients get diagnosed with diabetes, it's devastating. They're afraid. And a lot of times because they've seen an uncle or aunt or grandma or grandpa or somebody lose a limb or have some complication from diabetes. There's what movie is that where the grandmother had a complication from diabetes? Soul Food. You remember that movie?
Oh, yeah, of course.
I remember that movie, and when I watched it the first time, I didn't really understand what was going on. But then when I became a physician, I understand why a lot of people get so scared when they get diagnosed with diabetes. That was a very traumatic part of the movie. I remember crying in that movie when grandma is in the hospital, she has to lose a leg, and then she dies soon after. And then you've got this amazing matriarch who is no longer there to set everybody straight.
Right.
And so that's really how you have to think about it. Diabetes, I tell patients all the time. I had a patient who said to me, his A1C was 16. Very, very, very high. I mean, I'd never seen it that high before.
Jesus.
And I said to him, this is unacceptable. This is too high. He said, well, you got to die of something. And I said to him, pray that's what it does. Pray it kills you. I said, because it won't kill you. It'll maim you first. Wow. Diabetes does not kill people immediately. It makes you miserable, then you die.
Wow.
Affects your vision. Patients go blind from diabetes.
Wow.
Starts in the small blood vessels of your eyes. It can lead to cataracts. It can lead to total blindness.
Wow.
Then, of course, it affects your brain. So you have these tiny vessels that are in your eye. You also have tiny vessels in your brain. So it starts to create these little areas of clot and plaquing, which then lead to vascular disease of the brain, which can lead to stroke or even mini strokes. And the same thing, vascular dementia again. So that's the other part. Then it affects your heart. Patients who are diabetic have a higher risk of heart failure, have a higher risk of diabetes, 3 times more likely to have a heart attack if you're diabetic than another person on the street who even smokes.
Wow.
You have a higher risk just by being diabetic of having a heart attack over somebody who's non-diabetic.
Wow.
So that's the risk factor too. And we already know a lot of patients end up having kidney damage, kidney disease, on dialysis, kidney transplant, those patients who are diabetic. But unlike hypertension, those 3 organs are most affected, but diabetes affects so much more. It can affect the vasculature in your legs. So patients start having neuropathy or numbness or tingling in their legs, in their hands. And then it progresses up. You start getting ulcers on your feet. Some patients will even have it affect their stomach. You can have neuropathy in your stomach.
Wow.
It means you're chronically nauseous. You can drop a lot of weight. You can't eat food. Food comes right back up because your stomach, when you have gastric neuropathy or a neuropathy of the stomach, what happens is your stomach won't move food properly because the nerves aren't working. So that food can sit in your stomach for hours and hours. Eventually, you have to throw up to be able to even feel comfortable. It causes significant abdominal pain. Amputations, because somebody pricks their foot on a pin somewhere in the house because they can't feel it. And then it turns into infection. And because you don't have a good blood supply to your leg, we can't get the antibiotics down there to where it needs to go. And so sometimes we have to amputate a toe, then we amputate a foot, then we amputate below the knee.
Wow.
So it's a very complex disease with a lot of complications. Wow. So the first thing is just, if you are somebody who loves sugar, who loves sweets, testify, I love it. It's just not worth it. I tell myself, okay, if I want something sweet, I'll get it from nature. I'm going to have a pineapple. I'm going to have apples, I'm gonna have pears, I'm gonna have something sweet, strawberries, berries, whatever. I'm trying to get that sweet from nature, try to change my palate. But if I just have to have it, twice a month I'll say I'm gonna have something sweet and I'm just gonna indulge in it. I'm not gonna feel bad about it. But it needs to be something that is minimal. It's not worth it. All these complications, I see them all the time. And I'd rather live and not have to deal with those things than to enjoy that sugar.
So in closing,
yes,
if you are having any issues related to your sugar, basically you need to have a checkup with your doctor.
Absolutely.
So if you haven't been seen in the last 6 months, 3 months, year, you need to be making an appointment.
That's right.
Dr. Hare is available. She is in the Locust Grove area. Dr. Hare, give them your contact information.
Absolutely. So if you want to come see me, you can call our office. The number is 770-898-4685. 4339. If you would like to, if you want to use technology, we can schedule an appointment online. You go to www.piedmont.org and you type in my name, Dr. Hare, and our page will come up, and you just click to book an appointment online.
Well, I thank you so much,
Yes,
Dr.
ma'am.
Hare.
Yes, ma'am.
This topic has been very, very informative, and
Thank
I
you.
think it's very, very necessary for our community,
Yes,
because we do
absolutely.
see a lot of our people with diabetes,
Yes.
and it's uncontrolled diabetes.
Yes,
And
absolutely.
so I feel like this was a very, very important topic to share today, and I thank you so much. This was
Absolutely.
very informative,
Thank
even for
you.
me. So you guys, please take this information, share it,
Yes.
and please schedule an appointment today if you are having issues
Yes.
with diabetes, hypertension, or whatever. And Dr. Hare has given her information, so you guys call her.
Yes.
So once again, this is Lakeitha with Wellness Wednesday with New Mount Calvary. I thank you guys for joining us again, and we'll see you next Wednesday. Have a great day, everyone.
Bye, guys.
Thank you, Dr. Hare.